So we can go ahead and get started. If you have any questions, just let me know. So first off, we're just going to talk a little bit that after this section of my training, you should be able to initiate SCDs with patients and be able to communicate why SCDs are important. SCDs are sequential compression devices that are composed of different parts that all go together. The whole point of the SCDs is to basically keep the movement of blood flow in patients who are not regularly active to help prevent blood clots. SCDs are used for many different situations. One is, like I said, limited mobility. If they have a previous history or a risk of blood clotting, or if after surgery, if the patient needs that stability to be able to continue blood circulation after surgery. Do's and don'ts on how to initiate SCDs. A lot of times nurses, when they come in, they don't always bring in the SCDs with them. So the big idea is that bringing in this equipment can help to reduce the patient's anxiety. When they see this device, they will be less apprehensive about wearing them. They only have to wear it for about 18 hours during the day, which seems like a lot. But considering the patient who is immobile is usually in the bed majority of that time anyway, especially if they have just had surgery, they may not be able to get up and move around. So this is a very big issue. We want to make sure that when we are talking to our patients, we don't want to use the word SCD. Many patients don't understand what SCDs are. Always make sure you explain the actual words. We want to use sequential compression device instead of abbreviations. We also want to make sure to ask the patient if they know or if they understand what an SCD is, if have they used it before. We want to test their knowledge about SCDs because this can help with preparing education that they may need beforehand when you first introduce this device to them. This is what the SCDs look like. So you have the pump, you have the cord that actually plugs into a outlet, and then you have the sleeve. We also want to make sure that when bringing in the device that we bring in the sleeves, which are what wraps around the patient's legs. And you want to be sure to bring in at least 2 sizes. Bringing in one size that doesn't fit, you have to stop the education, you have to go back out to go and get the remaining equipment, and it takes a little while, and then the patient gets a little agitated with not having everything already ready to go.
How long will they be using these usually?
It depends on the doctor and the treatment that they have. A lot of times it's based also on their physical mobility. So the more often that they're able to get up and move around, the doctor may turn around and say, all right, the patient is more mobile, they won't need this equipment anymore. So this part is basically your physical ability to actually do the SCDs, to be able to demonstrate the order in which you would participate with the patient and trying to get them to wear SCDs. That's the difficult part, is to put everything in a nice wrapped bow package so that they will be willing to wear the SCDs during their hospitalization, and to continue that every time with every patient. So we want to make sure we have the machine. We want to have 2 sizes of the sleeves, one that you think is the size for the patient, and maybe one larger or smaller depending on what you feel their frame or size would be compatible with. And then we also want to make sure that we provide them written information if they need to, because a lot of patients, they may feel more comfortable reading about this type of device rather than listen. And then if they have any questions, let them know to write it down, and then you will definitely address any questions they have if they pop up later. Explain the reason why they're having SCDs. Just saying that, oh, this reduces blood clots, they may not know why. Is this because of surgery, or is this because I'm not mobile? They need to understand that the reason why they're having the SCD is something that their doctor would like for them to have and to use based on their medical condition. However, if they agree to the treatment, that's great, because then we can move forward and they can get any additional education as they go along, and to continue giving them the best outcome that they can with wearing the SCDs. If they refuse, there's a couple of things that has to be completed. We want to, one, determine why they're refusing. We never ask why questions, because that's very accusatory and it can put the patient in an offstandish, off-stand mode, where they're kind of like, feel like they don't have control over the situation, and so they feel a little irritated, maybe agitated. It would be better to use different phrases, such as, Is there a concern you have for wearing these SCDs or sequential compression devices? Is there a reason you do not feel comfortable wearing them? These phrases can make them a little bit more less apprehensive to wearing them, and it's more catered to them and not putting them on, I guess, a automatic refusal. If they aren't able to agree with it, the next step would be to inform your charge nurse so that they can help to further educate the patient and assess the situation as well. Can you explain the order of SCDs?
The order is in how you apply it to the patient. Going in, induce yourself, get the patient's identification like you always do.
Okay.
Explain what the procedure is, explain while they're getting it done. Show them the pump, show them the cuff, show them the wire.
All right, good. All right, Kelly, then can you explain what SCDs are?
They are a type of material. It's not like socks, but very similar, where they stay on the leg and they give a proper circulation to the leg to prevent blood clotting, reduce swelling of any type of inflammation or anything that is going on into the leg, so they won't have any issues.
All right, that's awesome, guys. The next section is basically just the last section. It's very short and sweet type of training session. But the big thing is that once you guys understand and learn what SCDs are and what they are for and how to approach the patient, to continue understanding what it does for the patient and to enhance your learning further, it's just to remember to attend more training about SCDs, because just learning it in nursing school is really, really great. And, having those periodic lessons during hospital trainings and things like that is great too. But sometimes I feel it drops off a little bit on education when you're actually working, because as we know, nurses have a lot of problems with time management and not having enough time because we have so much we have to do in that time frame. Sometimes we kind of just think SCDs should be put on hold on the last resort, where it's a major preventative which could actually help to keep patients from having other more invasive treatments, such as having to be on blood clotting medications and things like that. Seek out experienced, like a mentor, someone that like a knowledgeable nurse, and see how they approach it to other patients. A lot of times older, more experienced nurses have a really good knack with feeling out the patient and how to approach them so that they can be more receptive to doing the procedure and the treatment for them, so that this is for their benefit and not ours. So my thing is just to reflect on everything that you've learned. So is there something new that you didn't know before that has occurred? Another question is how do you feel about initiating SCDs?
I've always felt very comfortable about it, just because I had a friend whose mother unfortunately passed away from blood clots in the leg, so it's always been kind of important to demonstrate that emotion when speaking to somebody.
Okay. Anybody else?
Once you give that knowledge to the patient and to let them know, this will help you, this will circulate your legs or arms, whatever part that is swollen, and hopefully they would be on board and doing the process.
Right. I mean, it's really good for all patients to understand what it is, and I think that's the barrier with nurses going in. They'll go in, they'll talk to the patient, they'll say, hey, do you want to try this? And then the patient says no, without really giving them a lot of education on it. A lot of times too is that when the patient refuses, the next nurse that comes on shift should also, so if you're the night nurse and you've been given the transfer, the handoff is what we call it, to take care of the patient from now on, you as the nurse, knowing that the patient has refused from earlier, you still have to reassess and re-educate them on SCDs again to see if they'll be more able to wear them. We do want to make sure that we give the patient that control. Autonomy is always a big thing. Lastly is After this education, do you feel better prepared to actually educate patients?
Yes, I believe so.
Okay, well, tell me why you feel you would be more prepared.
It's just a reminder about how to put the patient's health into perspective. Tell them that the doctor has recommended this so they can feel better, and that's a preventative measure. And preventative measures are always more effective than emergency measures.
I would have to say I totally agree with Lewis on what he said. It really depends on what the doctor orders are for each patient, being that the patient has a lot more knowledge and that they would be more comfortable when you explain the knowledge to them to help them and benefit them.
All right, well, the last question I have is, do you have any questions about SCDs still, or patient education along with it, on how to actually educate the patient, or any other questions about SCDs?
I have no more questions.
My question is, even though that they wear the device in the bed, is it possible that the device is, can it be mobile too, or does it have to be attached to the bed at all times?
You can actually take the device. It's kind of hard for them to walk around with the device, but they could actually do it. It might be at more of a risk for them falling though, but you could actually have them sit in a chair. So if they want to move from the bed to the chair and rather sit in that, they can move around in the room. You don't really want them to walk around with it. The cords are all kind of attached. So, and it's attached lower at the bottom around the ankle. So walking probably would not be an option. Some patients like to get up when they shouldn't get up. So they have to have a device that alarms us that they're standing, and that would go off. So using one of those chairs may not be the best option.
Thank you for answering my question.
Absolutely. For joining me in this delightful training.
Okay. All right, thank you.
Bye.
Have a good day.
Have fun.